So a good case history, finding out what the kids are into, finding out family history. So trying to work out, how many parents in particular and siblings might already be short-sighted, because your risk factors for developing short sight certainly increase with the more family members you have who are also short-sighted. So finding out those sorts of things. So if parents can come in armed with their own prescriptions, that's very, very useful. And, we ask questions around their interests. If a child, is into high level soccer and they're training 6 days a week, well, that's a great sign from a protection point of view, versus a child who has no interest in sport and doing lots of screens. So we want to kind of know what sort of lifestyle influences are going on there. And then we go into the sort of case history of finding out how well they see the board and all of those sorts of things. Even though we are focusing on refractive error, so the degree of myopia, we also do want to know a lot about binocular vision. So convergence and focusing is still an important part of managing myopia, because there is an association of certain types of binocular vision issues that may influence the kind of treatments that you might decide on. And then if we have a patient who is at high risk of developing myopia or is already myopic, then we want to be doing that axial length measurement or biometry to have that as our kind of gold standard, as they call it, for monitoring progression. And so I think that's the field that part of myopia strategy that that I think will be the future, is really getting into identifying those kids who are at high risk before they even become myopic, and having some evidence-based strategies that we can use to try and slow things down when they're at high risk. And so having that body of information like axial lengths and things like that is a very, very important part of all of that.
I speak with some optometrists who deal with dry eye disease management, and what some of them have told me is that AI is also becoming a very useful tool for the diagnostics of that particular ailment. So I'm just thinking, maybe like as technology advances, maybe AI and similar sort of technologies may help more and more every year with myopia management.
And that's the thing. Both dry eye and myopia have a huge amount of research being done, and some overwhelming amount of research that's being done. And yes, we look forward to things like tools and calculators where you can say, okay, this is the person's eye length, this is their corneal curvature, this is the number of hours a day they do X, this is the number of hours they do Y, this is how many parents and siblings have it. And we've got sort of fairly basic calculators for that now that kind of help you work out is someone at low risk, medium risk, high risk, those sorts of things. So AI is going to make that a lot more nuanced and hopefully a bit more sort of targeted, particularly, like I said, when we get into that whole predicting future myopia risk in kids.